The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan, and thanks to everyone for listening in. A few weeks back, I had my year in review and predictions for 2026 podcast. In that, I said that there was about a 50-50 shot that a compromise would be reached to extend the enhanced exchange premium subsidies in some form. Well, given Congress is now back, I wanted to tackle a bit of that story again and also discuss more broadly the topic of affordability and its impact on the 2026 midterm elections. In my predictions podcast, I also said the Democrats would retake the House after the midterms are held, with the Senate staying in GOP hands. I made this podcast about 10 days before it's being aired, so I hope it is still accurate. But you may be aware of some developments I was not when you listen to this one. We'll take our usual 3 breaks, so let's get into the issue of affordability and how it will dominate midterms. Affordability will be the election theme for the 2026 midterms. This will apply across Americans' lives. While real wages have indeed mostly kept up with prices of late, there is a serious concern among Americans that getting ahead is out of reach for many Americans, especially younger ones. Affordability very much brought Donald Trump and the GOP to dominate Congress right now, and the same issue could very well be their undoing in 2026 elections. With that, we'll take our first break, and when we come back, I will jump into how affordability is most pronounced in healthcare. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage and a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back. We hope you are enjoying this episode of the Healthcare Labyrinth Podcast. We're talking affordability in healthcare, the 2026 midterms, and prospects for a compromise on exchange subsidies and perhaps more healthcare changes. Before the break, I told you that the affordability issue is most pronounced in healthcare. We have seen huge price and inflation trends in healthcare since coming out of the COVID pandemic, and there is little sign that the aggressive trends will subside anytime soon. In the biggest world of employer coverage, trends have been 6% and 9% the past few years. Family coverage now costs on average almost $27,000 per year, with employees paying almost $7,000 of that in upfront cost before deductibles and cost sharing are even considered. Researchers from Rice University and Baylor College of Medicine found that average worker contributions toward family insurance premiums grew by 308% between 1999 and 2024. Total premiums increased 342%, while average worker earnings increased by 119% and inflation increased by 64%. Another shocker was that Part B premiums in Medicare increased 10% for 2026. Beneficiaries pay 25% of total costs in Medicare, with the government covering 75%. Thus, the 10% is a good proxy for annual growth in the program. As well, Medicare Advantage benefits have eroded for 3 years in a row now, brought about by rate reductions in some years, surging costs, and poor financial management by plans coming out of COVID. And finally, the One Big Beautiful Bill Act erodes Medicaid and exchange coverage by imposing Medicaid work requirements, limiting Medicaid state matching revenue raising ability, and restricting enrollment in both programs. Those who continued on the exchanges in 26 have seen premiums on average increase 26% nationally. Those who had subsidies in 2025 will see average premium hikes of 114% due to enhanced subsidies sunsetting. In sum, across every line of business, Americans are feeling the heat of obscene costs in healthcare. More and more employees cannot afford to enroll in employer-sponsored coverage or afford to use it if they can even pay the freight. Medicare recipients are facing surging costs and reductions of benefits and choice. Millions will lose Medicaid and exchange coverage due to the One Big Beautiful Bill Act or face huge exchange premium hikes due to the expiration of enhanced premium subsidies. With that, we will take our second break, and when we come back, I will jump into what may happen in 2026. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back. We hope you're enjoying this episode of the Healthcare Labyrinth Podcast. We are talking affordability in healthcare, the 2026 midterms, and prospects for a compromise on exchange subsidies and perhaps more healthcare changes. Let's get back to it. Republicans have this hope that somehow they can pin healthcare unaffordability on Democrats' passage of the Affordable Care Act of 2010. While some criticism is warranted, the program remains popular among Americans, and voters are unlikely to buy the GOP's arguments. Republicans, too, may push additional healthcare reform in 2026 to insulate itself. We'll talk more about this soon. But Democrats will point to the One Big Beautiful Bill Act as the reason for coverage losses and premium spikes. Much of unaffordability is driven by a lack of true healthcare vision from both parties, but it won't matter in the end. Democrats' unaffordability arguments will resonate generally and specifically on healthcare. Even the relatively good work by President Trump on drug price reform will not save the day for the GOP. What may come in 2026? There is at best a 50-50 shot that the subsidies are extended in some form. Democrats have gained some momentum on extending expiring enhanced exchange premium subsidies when 4 House Republicans signed on to a discharge petition to force a vote on the subsidy extension. The 3-year extension could very well pass the House, but it does face issues in the Senate. A similar bill has already been voted down. But the bill that comes over from the House could then be used for a master compromise in the Senate that could then go back to the House and perhaps pass. A second government shutdown again looms as well toward the end of January. The GOP likely is more afraid of yet another shutdown than Democrats, and that could make for some momentum to pass a compromise. But there are barriers. Republican leaders in each house are aligned with conservatives who oppose any extension of the subsidies. Democratic leaders would push back on a too watered-down extension, as well as GOP add-ons that water down comprehensive coverage. With that, we will take our last break, and when we come back, I will jump into what a grand compromise could possibly look like. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back. We hope you are enjoying this episode of the Healthcare Labyrinth Podcast. We are talking affordability in healthcare, the 2026 midterms, and prospects for a compromise on exchange subsidies and perhaps more healthcare changes. There is the possibility that a grand bargain or compromise comes together. Moderates in each house on both sides of the aisle could prevail in this way. There could be a shorter extension, perhaps 2 years. There could be changes to the existing enhancements, including minimum premiums for everyone, a cap on subsidies above 400% of the federal poverty level, but not unlimited, as the expiring law has now. Other anti-fraud and enrollment protections above and beyond those in the One Big Beautiful Bill Act to address rather legitimate concerns about fraud and improper enrollment, appropriating cost-sharing subsidies again. While this hurts some enrollees between 200% and 400% of the federal poverty limit, it does lower overall premiums for those above 400% of federal poverty by eliminating the so-called silver loading of premiums. Democrats might have to agree to GOP demands for including its priorities, which could include expansion of employer coverage reimbursement, known as ICRAs, expansion of health savings accounts and individual options, some expansion of alternative coverage, including association health plans, limited duration plans, direct primary care, and more. I have come to the conclusion that some of these are merited as comprehensive coverage mandates have failed us, and they can serve as a critical bridge, sometimes combined with catastrophic coverage, as we await real healthcare reform. At the same time, we need to understand that such approaches, including individual access, could have profound implications on the viability and ongoing costs of employer coverage. It has been and should remain the foundation of our nation's coverage. As I have argued, though, all of this is window dressing if the parties are actually trying to tackle the affordability challenge. The parties would be smart to begin to tackle the real culprits and look at the following. Instituting site-neutral payments in Medicare, which would save hundreds of billions over time in both Medicare and the commercial world. Realigning price in both the medical and drug world, including regional and national all line of business pricing. Reducing to law many of the things the president has worked on for drugs would be important as well. Thus far, the president seems to have focused on Medicaid cost and self-pay reductions for drug prices. 2 new models will begin to impact Medicare drug prices, but little has been done to impact commercial and employer drug costs. Congress should also tackle the primary care crisis in America. Tackling the crisis could help control disease states and the pernicious effect that a lack of primary care has on costs and outcomes in America. Congress should tackle pharmacy benefits manager reform. Lawmakers should address legitimate risk adjustment overpayment in Medicare Advantage. And last, Congress should plot a course on true scrutiny and oversight of the massive horizontal and vertical integration in healthcare that is driving up price as well with each consolidation and merger. With that, we will conclude this edition of the Healthcare Labyrinth Podcast. We will see you next week. Take care.
Thanks for joining Marc and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.